My fellow Ilonggos, the country is currently facing an alarming situation that has placed the lives of Filipinos in jeopardy. To overcome this, it requires the cooperation and partnership of the government, the private sector, and the people. Together with ILOILO Governor Defensor Jr., Governor Gumarin of Guimaras, Governor Miraflores of Baclan, and Governor Contreras of Capiz, we discussed the best option for the welfare of the whole Panay Guimaras Islands in fighting against the COVID-19 pandemic. With the fast increasing number of COVID-19 cases in the country, there is a need for us to take immediate and necessary steps to mitigate the dreadful situation. All individuals arriving from countries and areas, including Metro Manila, with known local transmission of COVID-19 are now considered as PUMs. Upon arrival, PUMs must immediately coordinate with their respective barangay health emergency response teams, health office, and local hospitals for assessment with possible COVID infection in the healthcare facilities. PUMs and PUIs with mild signs and symptoms must undergo strict self-home quarantine measures, while PUIs with severe manifestations will be placed under hospital quarantine. Health declaration checklist should be mandatory and for strict compliance in all ports of entry in the Panay Guimaras Islands. Class suspension for all levels for both public and private schools under EO 49 is extended from March 16 to April 14. My pronouncement under Executive Order 49 for students in the duration of the suspension of classes not to enter establishments where social distancing cannot be observed remains effective and shall be strictly observed. I would like again to appeal to all our religious groups to cancel religious gatherings and services for the time being. Stringent social distancing measures among constituents shall be strictly observed. The last Executive Order 50 in Iloilo City suspends and prohibits non-essential entry of persons traveling by sea within the city of Iloilo to contain and prevent the spread and or local transmission of 2019 novel coronavirus from March 16 at midnight until April 14, 2020. Passengers traveling by sea coming from Metro Manila, Batangas seaport through the Roro, and those entering Iloilo City can be shown to have come from 120 countries identified by the WHO shall not be allowed to enter Iloilo City from March 16, 2020 at 12 midnight until April 14, 2020. Passengers who may be immunocompromised or those who are at higher risk of being infected by COVID-19 shall be subjected to the protocols issued by accredited health authorities. The essential entry of persons to Iloilo City shall be defined exclusively and shall include only the following: healthcare workers, authorized government officials, those traveling for medical or humanitarian reasons, persons providing basic services and public utilities, essential skeletal workforce, returning residents of Iloilo City who have been tested and cleared, other such persons who may be defined, identified, or cleared by our health authorities. The carriage of goods and cargo will be unhampered but shall be subject to compliance with DOH guidelines. crew or passenger of the cargo ships or vessels cannot be allowed to disembark from their ships during the period from March 16, 2020 at 12 midnight until 14 April 2020. The local government will coordinate with the PNP, the Army, the Coast Guard for the enforcement of guidelines and will establish an interagency task force for the Panay Guimaras Islands with the aid of law enforcement agencies to convene regularly to study and continuously review the measures and guidelines in addressing COVID-19 situation. A systematic risk management based on collaboration between government officials and the DOH, DTI, DOLE, PNP with the other key government agencies will be resorted to. We need to move as quickly as possible to stop the chain of transmission and before the virus penetrates the Panay Guimaras Islands. Let us help one another in defeating COVID-19. Be vigilant. Do not spread fake and unverified reports. Instead, rely on public health, your local government advisories for accurate information about COVID-19.